This video is a kind of a part 2 to the first one, or the previous video I have done. I wanted to show you one stroke of effleurage that we were not able to do on the posterior leg. This is heart effleurage, and this one really covers a lot of territory on the back, and that's basically what we're making is a heart. I usually do 2 hearts. Or you can simply go down the erector spinae group, those ESGs, come up, out, and back over. It's a nice way to warm up the back, nice way to introduce massage to the back. And then we'll follow into some of our other classifications of stroke from the previous video. As we warm the back up, I can even come down the upper arms, and all of this is effleurage. I can again use my fists. And what's really nice, I have a large area here to cover. It's like a big piece of canvas. And I am able to do my forearm work. Petrissage on the back sometimes can be a little bit tricky. So what we can do is kind of a combination of our skin rolling and our fulling, where we can kind of lift the tissues, bring them up between our thumbs. And that way we're getting a lot of hyperemia. We're really separating and working a lot of that fascia. And we're able to do it to the entire back. We can go ahead and do our 2-handed petrissage on the upper trapezius. We can turn them and go into those delts and down into those upper arms. Some of our deep gliding, that's called our ironing. So this is deep effleurage, and it's called ironing. And once again, I can use my fists or my forearms. Save those hands. What about our circular, deep effleurage? I kind of like to divide my back into like a 1/4 and 3/4. Then that deeper circular effleurage comes in handy when we're working those ESGs. And then once again, look how nice, right over, or on top of, I should say, some of these sits muscles, and on down into the upper arms. Nice, some deep gliding up that posterior neck. I like to gather that tissue together right at that C7T1 junction. And what about some of our frictions? Really great on these rhomboids. This is a little more of the parallel. And I'm using, remember, don't hyperextend those thumbs. And again, taking bites. Here on those ESGs, I'm doing some parallel friction, or again, taking my bites. I can do some of that circular friction. Back to cross fiber. And we were thinking about this ringing. Look at the ringing. This is one of the variations of friction. And we're able to move that tissue over each other, superficial to deep. And then we're able to come on down and into our sideline work, where we continue again with our transitional effleurage and petrissage. This one is now alternate petrissage. We can use our forearms to kind of move into that thoracolumbar stretch. This is that broadening we talked about. Nice petrissage on the posterior neck. And here we are back at the top. You can always come back again, reaching some of those attachments for the sits muscles, paying attention to those very lengthened sometimes with rolled shoulders, protracted shoulders, and release those. Remember, friction are our treatment strokes, really effective. And reducing that hypertonicity. The most important thing is you learn to reach into that bag of tricks where we have our classifications of strokes, Swedish massage strokes, along with their variations. And now we're going to say goodbye to our back. With some nerve stroking. Just to say goodbye again to the back. And then we'll redrape our client. And we conclude the massage.